I am Dr. Ravi Shankar, Medical Gastroenterologist and Director of Gastroenterology Services, Yashoda Hospital, Hyderabad. Today, I will discuss a few things about gastroesophageal reflux disease. It's called GERD or GERD. It's popular as GERD, and this is a very common problem. So, lots of people have this disease of GERD. So, we can say that up to 10% of the people may be suffering this disease. Majority of the patients have mild disease and they may be handling this problem with minor medications like antacids or sometimes pop in some tablets like pantoprazole or rabeprazole. Now the real issue exists with some of these patients who have moderate or severe disease. So what are the symptoms of this disease? The symptoms are heartburn. That means it's not exactly the heart, but it's a burning sensation in the center of the chest. And regurgitation, that is the food coming up suddenly into the throat or into the mouth sometimes. And the patients can have some amount of extraesophageal manifestations like cough, asthmatic type of attacks, and dental problems as well. So the commonest symptoms are heartburn and regurgitation. So of these symptoms, patients suffer most with heartburn, and some of the patients may get confused with cardiac disease and other ailments. So what to be done for this disease? One has to make a proper diagnosis. Interaction with their doctors is essential, and based on the symptoms, doctors do treat these patients. So what are the drugs that treat this disease? It is the proton pump inhibitors, otherwise called the pantoprazole, esomeprazole or rabeprazole, so on and so forth, and H2 receptor blockers like ranitidine, famotidine, lafutidine, and so on and so forth. There are other medications as well. So majority of the patients get these drugs and they do well, but a minority of patients, the disease continues to exist and it responds to the medication, but it comes back, the symptoms come back once the drug is stopped. So these are the group of patients who require high-end treatments. So what are the treatments that are left for these patients who have symptoms on a continuous basis, who respond to medication, but again the symptoms come back viciously? So one is medical treatment, that is continuation of the medication for longer time. How long is to be decided based on the symptoms of the patient. The second treatment could be surgical treatment, a laparoscopic treatment. In between the medical and the surgical treatments, we have certain endoscopic treatments which have come up in a novel way. These could be Stretta, Arma, or Gerdex. These three are available in the country, and these could be performed after properly selecting the patients. So overall, GERD is a disease which is common. Symptoms may be mild in majority of the patients. Symptoms could be in a minority of patients moderate or severe. And these patients who go on having their symptoms for long duration require treatment with medications for long duration or surgical treatments or novel endoscopic methods. Thank you.